Hi, my name is Bailey Hillman. In this video series, we've been discussing COVID-19 and dementia. If you are a caregiver of a loved one who is receiving home-based services in your home, such as a nurse coming in or an aide coming in to assist with bathing. If you're receiving therapy services, there are a few things that you're going to want to ensure and questions that you're going to want to ask the team as they come into your home each time. These are not unreasonable. So do not let anyone tell you that these questions are unreasonable. It is very important that you are cautious and that they are cautious as well. And so you can have rules in your home and your healthcare agency or your home health or personal care attendants need to abide by your rules. That is perfectly normal. Okay, they're going house to house to house to multiple people. So you're wanting to make sure that when they come into your home, they're practicing good safety during COVID-19. So the first thing is you want to make sure that before they enter your home, they do a self-temperature check. Okay, you can have them do it. You don't have to do it for them, but you can have them check the temperature and you can verify that they have a temperature below 100.4. Okay, so 100.4 is where the CDC is recommending. Anything below that is not considered a fever. You can say if you have something in 99 or higher, you're not coming in my home, but 90 or 100.4 degrees Fahrenheit, they should not be providing care if it's above that. Okay, you need to also ask, have you been exposed to anyone who has tested positive for COVID-19? All right, if they have, then you need to ask, have you been tested for COVID-19? All right, or are you having any symptoms of COVID-19? If they've been tested, you would definitely want to make sure that they tell you that it's been negative. Okay, so you want to make sure that they're saying it's negative. The next thing that you want to say is, so after they've taken their temperature, after you've questioned and said, hey, have you still not come into contact? And it's okay to ask this every time they come in. Okay, do not think that it's not reasonable to say every time you come in, I'm going to ask you these series of questions, and I want to know for sure that you're continuing to be safe, because you need to know what risk you and your loved one have. The next thing is that you need to make them go wash their hands. So you might have them gel. Okay, so you might have some hand sanitizer at the front door so they can go ahead and put hand sanitizer and clean their hands, but then make them go use soap and water. All right, use soap and water. So if it's easier for them to get to the kitchen and not have to touch anything, you can have them use soap and water. My other recommendation is that you can have them wear something on their shoes. Research is showing that COVID-19 can travel on shoes. So you could have them put either, plastic bag on their shoes, or ask them to bring the footies that can go over their shoes, or if you can get footies, or if you want to just say, hey, you got to take shoes off when you come in my home. I mean, right now it's different. It's a different time, and we all have to be flexible with ensuring that we're keeping our elders safe. And so that is not unreasonable to ask. The next thing is, so before they even come in, you want to make sure they're wearing a mask. Okay, they need to be wearing a mask. If your loved one with dementia will wear a mask, they need to have a mask on as well. Okay, a mask, and if eye protection is available, eye protection as well. Okay, so you can get the safety goggles from Home Depot, or glasses. I mean, glasses are good, but people still have a tendency to reach up underneath and rub their eyes. With safety goggles, it has the sides, so they don't tend to get in them as much. So have the team wear a mask and safety eye protection if possible. All right. It does not have to be an N95 mask if nobody's been positive, but a cloth mask for sure, surgical mask even better, and then the eye protection. Okay. It's okay for you to know what people are bringing in your home. Okay. So eye protection, foot protection, or take your shoes off. I mean, and I would let the agency know before your healthcare provider gets to your door, say, here's the processes that I'm going to be putting into place. Okay. X, Y, and Z. And they are going to have to abide by it, or you're going to have to find a different nurse, different aide, or different therapist to come in my home, because I'm not going to take the risk of my loved one and myself being exposed to something that's been traveling around. The last resort would be that you just stop services completely, okay, which I know is a burden on you as a caregiver, but at some point, depending on where you live and what kind of hotspot, I mean, right now, New York is, exploded with the numbers of COVID. There's no way if I have a loved one that I would be letting healthcare workers in and out of my home, especially not different ones. So if I had a routine, consistent crew that came in, I might consider it. Might, okay, but most likely I would not consider having them in. I would just try to adapt and do the services myself. If you did that, I would ask, hey, is there an exercise routine, like a print-off sheet that you can give me to assist me in better caring for my loved one? That is very reasonable as well. So again, if you have people in your home, it is okay. It is okay. No matter what, if they make you feel guilty for asking every time they come in, or if they make you feel guilty for requiring them to wear masks or booties or taking their shoes off, you need to find a different agency. Okay. Because that is not unrealistic. If it was in my home and I'm a healthcare worker, okay, I take my shoes off before I even enter the door. I was exposed in my nursing home, and I wore mask at home, okay, because I don't want to expose my family. So it is not unreasonable, okay, to be asking these questions. I am going to leave a link below just typed out so you can print it out so you can have a guide as to what you need to ask and questions that you might want to ask. But good luck, okay, and it's okay to protect you and your loved one. Please subscribe to our channel, Everything Dementia, and also join our Facebook group. We have an Everything Dementia support group on Facebook, and there are great tips and resources. We're building our group, so it's quite small now, but it's great and it's personable, which is so nice. And I'm on there consistently, and I have a team of people that also get on and respond. So any questions you have, we are here to support you. Thank you for watching this video, and don't forget to subscribe and hit the bell so that you get notifications when there's more videos that are launched. Thank you.